Hello, my name's Adrian Richards. I'm a plastic and cosmetic surgeon based in the south of England, and I'm the lead surgeon for Aurora Clinics. Today is the 16th of September, and I'd just like to talk through some of the findings into the national inquiry into cosmetic surgery, which has been published today. Now, this inquiry is concentrates on different specialities in different years, and plastic surgery is the focus of the study in this year, and it really found significant weaknesses in a lot of the plastic surgical units and surgeons that are performing these operations in the United Kingdom. And I'd just really like to read some of the topics, the findings from the report, and sort of discuss those with you. So first of all, the leader of the report, Alex Goodwin, felt that too many teams were prepared to have a go at procedures they rarely perform. So this is very important. You really do need to ask your surgeon how many of these procedures they perform a year, how many they have complications with. So really you should be looking, I think, for most procedures to have a surgeon that performs at least 50 of these procedures. That's on average of one a week, really, per year as a minimum. Okay, so they also found that 56% of plastic surgery providers did not have the necessary equipment to provide the procedure safely, which is really very worrying in the United Kingdom. 18% did not have a policy for readmitting patients. Now, if you have an operation and you have a problem straight away, bleeding is the most common one that can occur really quite quickly in about 1% of people, particularly have breast implants. If you have got that problem, it does need to be sorted out really within a few hours. So 18% of hospitals not having those sort of procedures is again really quite worrying. Also, 33% of hospitals were found not to have an on-call rota for an anaesthetist. So if there is an emergency, you will need an anaesthetist to help you. So I think it is important to ask about the consultant on-call rota and whether you will be covered. Also, we do recommend a two-stage consent process before any operation. So it's very important if you are considering an operation. This is certainly the way we work at Aurora Clinics, is you'll come and see me, then you'll probably see my nursing staff, and we'll go through the procedure. We would always like to get you back to go through it once more. At the first consultation we discuss information, then we encourage you to watch our information videos. We give you information about the procedures, so we encourage you to read and digest that before your second consultation, and then you decide whether you'd like to proceed with your second consultation. So we don't want you to really rush into a hasty decision for treatment, because hasty decisions often cause long-term angst, and really it's a big decision. It needs to have the proper time to consider it. And the really worrying thing is that the report found that only 44% of operating theatres were fully equipped to carry out these procedures. Now, this is very worrying. I feel that any cosmetic surgery procedure is really performed in the latest operating theatre with laminar airflow. So that's a special type of airflow which changes the air in the theatre many times per minute, and I think really reduces the risk of infection. So overall, the report, I think, was a wake-up call to the cosmetics industry in the United Kingdom, and certainly as patients you should be aware of it. I would encourage you to read it and discuss it with your surgeons and ask them specific points about the facilities they use, how many procedures they perform per year, and their procedure if you do have a problem. Thanks very much for listening to the video, and if you have got any questions, please feel free to email us at info@aurora-clinics.co.uk, and we'll be happy to answer any queries you have.